everyone, we will discuss about the indication and contraindication of warfarin. The indication of warfarin. First, warfarin is used in prevention and treatment of venous thromboembolisms. Next, for prevention and treatment of thromboembolic complications associated with atrial fibrillation and cardiac valve replacement, and also for reduction of recurrent myocardial infarction and thromboembolic events. Prevention and treatment of venous thromboembolism, which consists of deep vein thrombosis and its extension pulmonary embolism. DVT is a blood clot that forms in a vein deep in the body. Mostly, deep vein blood clots occur in the lower leg or thigh. They also can occur in other parts of the body. A blood clot in a deep vein can break off and travel through the bloodstream. The loose clot is called an embolus. Embolus can travel to an artery in the lungs and block the blood flow. This condition is called pulmonary embolism. It can damage the lungs and other organs in the body and cause death. Next, warfarin is also used in prevention and treatment of thromboembolic complications associated with atrial fibrillation and cardiac valve replacement. Atrial fibrillation is a heart condition that causes an irregular heart rate. The way the heart beats in atrial fibrillation means there's a risk of blood clots forming in the heart chambers. If these enter the bloodstream, they can cause a stroke. By giving warfarin, it can reduce the risk of stroke in AF patients. Next, cardiac valve replacement is a surgical procedure where the damaged valve is replaced with a new artificial valve. Addressing warfarin can minimize post-operative thrombotic complications while maintaining acceptable levels of risk related to bleeding. Finally, warfarin is used in reduction of recurrent myocardial infarction and thromboembolic events. Survivors of MI are at increased risk of recurrent infarctions. By giving warfarin, it can reduce the risk of further vascular events in patients with MI and stroke and thus reduce mortality rate. Now, we will discuss about the contraindication of warfarin.
Warfarin is contraindicated in pregnancy because warfarin can pass placenta barrier and may cause bleeding in the fetus and spontaneous abortion. However, pregnant women with mechanical heart valve is exceptional. They should be notified of the potential harm of warfarin to the fetus.
Warfarin also contraindicated in malignant hypertension. Malignant hypertension is extremely high blood pressure that develops rapidly and causes some type of organ damage. The risk of bleeding is higher for this patient to take warfarin. Next, contraindicated in bleeding tendency. Any condition of patients who are prone to bleeding such as gastric ulcer, hemorrhage, bacterial endocarditis cannot be prescribed with warfarin because these patients have a defect in coagulation system, thus prolong the bleeding and can cause further complications. Warfarin also contraindicated in patients who have planned or scheduled for surgery. Warfarin cannot be used in a patient who is scheduled for any kind of surgery where there is a high risk of bleeding. If he is already on warfarin, he needs to withhold warfarin for a sufficient period of time. Furthermore, warfarin is also contraindicated in patients who have hypersensitivity to warfarin. If the patient develops an allergic reaction to warfarin, other anticoagulation can be considered. Other conditions that warfarin cannot be used are preterm abortions and patients who are very poor compliance. Contraindications to using this medication are typically based on risk versus benefit. If the beneficial use of warfarin is outweighed by a higher risk of bleeding, the patient cannot be placed on warfarin.
Created using Powtoon.